Ever feel like you're running on empty? Like the weight of the world is on your shoulders? That's stress. And while our bodies are built to handle it in short bursts, what happens when it just never stops? Let's dive deep into what long-term chronic stress is really doing to your body, system by system. You might be surprised at how interconnected everything is. First up, the musculoskeletal system. You know that feeling when you're startled and all your muscles tense up? That's a reflex, your body's way of guarding against injury. Normally, once the threat passes, you relax. But with chronic stress, your muscles can stay in a constant state of guardedness. This isn't just uncomfortable. It can lead to bigger problems. Think tension headaches, migraines, and even chronic pain in your back, shoulders, and neck. It's a vicious cycle. You feel stressed, your muscles tighten. The tightness causes pain, and the pain causes more stress. Over time, if you avoid movement because of this pain, your muscles can weaken, making the problem even worse. The good news? Relaxation techniques and gentle, supervised activity have been shown to be incredibly effective at breaking this cycle, reducing tension, and improving your overall well-being. Now let's talk about breathing. The respiratory system's job is simple: get oxygen in, get carbon dioxide out. But when you're stressed or experiencing strong emotions, your airways can constrict. Have you ever felt short of breath when you're anxious? That's what's happening. For most of us, our bodies can handle this temporary extra work. But for people with conditions like asthma or COPD, psychological stress can seriously exacerbate their breathing problems. Studies have even shown that a major stressful event, like the death of a loved one, can trigger an asthma attack. And that rapid breathing, or hyperventilation, can sometimes spiral into a full-blown panic attack for those who are prone to them. This is where working with a professional can be life-changing. Learning breathing exercises and other cognitive strategies can help you regain control when you feel that tightness in your chest. Next, the heart of the matter, your cardiovascular system. When you face an acute stressor like slamming on the brakes in traffic, your body goes into fight-or-flight mode. Your heart rate skyrockets, your heart muscle contracts more forcefully, and stress hormones like adrenaline and cortisol flood your system. Blood is redirected to your major muscles, and your blood pressure goes up. It's a survival mechanism. Once the danger passes, everything returns to normal. But what if it never passes? That's chronic stress. A constantly elevated heart rate, high blood pressure, and high levels of stress hormones take a toll. This long-term strain increases your risk for hypertension, heart attack, and stroke. It can also cause inflammation in your arteries, another pathway linking stress directly to heart disease. Interestingly, how you respond to stress can even affect your cholesterol levels. For women, estrogen seems to offer some protection by helping blood vessels respond better during stress. But after menopause, this protection diminishes, putting postmenopausal women at a greater risk for the heart-related effects of stress. Let's move on to the endocrine system, our body's command center for hormones. When your brain perceives a situation as threatening or overwhelming, it kicks off a chain reaction called the HPA axis. This process ends with your adrenal glands pumping out cortisol, the famous stress hormone. Cortisol's job is to give you a quick energy boost by releasing glucose and fatty acids into your system so you can deal with the challenge. In a normal day, cortisol levels rise when you wake up and slowly fall, giving you a natural energy cycle. But during chronic stress, this system goes into overdrive. While cortisol is also important for regulating your immune system and reducing inflammation, too much of it for too long can mess up the communication between your immune system and your HPA axis. This breakdown has been linked to a whole host of health issues, including chronic fatigue, metabolic disorders like diabetes and obesity, depression, and immune disorders. Now for a system we all feel stress in, our gut. Ever feel butterflies in your stomach? That's your brain-gut connection at work. Your gut has hundreds of millions of neurons, sometimes called a second brain, and it's in constant communication with the one in your head. Stress can disrupt this conversation, making you more sensitive to pain, bloating, and other discomforts. It also changes the landscape of the millions of bacteria living in your gut. These gut bacteria influence your mood and your ability to think clearly. So a stressed gut can literally lead to a stressed mind and vice versa. For some, stress messes with appetite, making them eat much more or much less. This can lead to heartburn or acid reflux. And while stress doesn't cause stomach ulcers, that's a bacteria, it can certainly make them feel worse. It can also affect how quickly food moves through your bowels, leading to either diarrhea or constipation. For people with chronic conditions like IBS, stress can be a major trigger, making their symptoms much more intense. Let's look at the nervous system, the master coordinator of the stress response. It's divided into the central nervous system, your brain and spinal cord, and the peripheral nervous system. A key part of the peripheral system is the autonomic nervous system, which has two main branches. The sympathetic, our gas pedal, and the parasympathetic, our brake. When stressed, the sympathetic nervous system kicks in, activating that fight or flight response. Your heart pounds, you breathe faster, and sugar floods your bloodstream for energy. It's a sudden, powerful reaction designed for short-term emergencies. Once the crisis is over, the parasympathetic nervous system is supposed to take over, calming everything down. But with chronic stress, the gas pedal is constantly being pushed. This continuous activation wears your body down. It's not that stress damages your nervous system directly. It's what the constant activation of the nervous system does to all your other body systems that becomes the real problem. Now, let's talk about the reproductive system, starting with men. The nervous system plays a huge role here. Arousal is managed by the sympathetic nervous system, but chronic stress throws a wrench in the works. The constant release of cortisol can interfere with normal testosterone production. Stress doesn't just affect desire. It can impact fertility. When stress weakens the immune system, it can also make the body more vulnerable to infections in the prostate or testes, further affecting reproductive health. For women, the effects of stress are just as profound. High levels of stress can be linked to irregular or even absent menstrual cycles and can make period pain worse. Just like with men, stress can significantly reduce sexual desire, especially when juggling the many demands of life. Stress can also negatively impact the ability to conceive, the health of a pregnancy, and the postpartum period. In fact, excess stress increases the risk of depression and anxiety during and after pregnancy, which can affect the mother's bond with her baby. As women approach menopause, fluctuating hormones can be a source of stress themselves, causing anxiety and mood swings. Emotional distress can then make physical symptoms like hot flashes even more intense. And just like in other systems, when stress is high, symptoms of reproductive conditions like polycystic ovarian syndrome can get worse. So you can see, stress isn't just in your head. It's a powerful force that has real, physical consequences throughout your entire body. From your muscles to your heart, your gut to your brain, every system is impacted. Recognizing these signs is the first step toward managing stress more effectively. If any of this sounds familiar, it's a sign to listen to your body. There are so many tools and strategies available, from therapy and mindfulness to exercise and better sleep. If you're feeling overwhelmed, please know that help is available. Talk to a doctor or a mental health professional. Taking care of your stress is taking care of your health. Thanks for watching and take care of yourselves.